Hi, my name is Dr. Johnny Levy. I'm a skin cancer doctor and also the medical director of Skin Squared, a chain of skin cancer clinics. I'd like to talk to you about basal cell cancer, BCC for short, which is a cancer that isn't as well known as, for example, melanoma as a skin cancer, but is far, far more numerous and in fact will account for the majority of all cancer diagnoses this year. For something so prevalent, it is very fortunate that it is not as deadly in any way at all as melanoma. In fact, it rarely kills patients, but it does cause a lot of surgery to be done on patients to remove basal cell cancers, and that causes scars and sometimes cosmetic issues. So the key with basal cell cancers is to find them as early as possible, when they're as small as possible, and therefore the surgery that is required is the least possible and causes the least damage. In fact, sometimes when they're still superficial, they can be treated with just creams, which is wonderful. What to look for? Well, basal cell cancers can come in a variety of shapes and sizes. Commonly they can be flat and red, but they can also be nodular, so slightly raised and pearl-like. They can have little ulcers in the middle, and they can sometimes bleed or itch. Overall, when you check your skin and if you see something that stands out as looking different to everything else in your skin, that's the one to take to your doctor. Make sure that they know about skin cancer and they use something called dermoscopy. Better than all of that, and all of that is important, but better than all of that is to avoid getting a skin cancer in the first place. Basal cell skin cancers are highly dependent on sun to be caused. Sun causes nearly 100% of them, and they grow in sun-exposed areas, typically from the upper torso up onto the neck and onto the head. So if you can avoid sun, to slip, slop, slap, seek and slide, then you will avoid the risk of growing a basal cell cancer to as much extent as is possible. Be careful over summer. Make sure you are careful with the sun. Check your skin and get anything checked out that seems unusual to you.